Good day everyone, I am Lyan C. Baril and I'm here to talk about the 15 administered medication. So for the number one is that we nurses will gonna administer medication because these are the responsible for their own actions. So we can also call some person who are prescribed the medications for clarification. Then for the number two is that we nurses are knowledgeable about the medications that we will gonna administer. And then also, if you are not familiar with the medications, um, look up the necessary information on it. So number three is that federal laws governs that are use some narcotics and barbiturates. Um, keep these medications that are locked in a place. Number four is that use only medications that are in a clearly labeled container. So for the next is number five is that do not use some liquid medications that are cloudy or have changed color. So number six that calculate some drug doses that are unaccurately. And then if we nurses are uncertain, so we're gonna ask another nurses to double check on the calculations. Number seven is that administer some only medications that are personally prepared. So number eight is that before administering medication, we will gonna identify client that are correctly using the appropriate means of identification, such as checking the identification of the bracelet. Next is number nine is that do not leave some medications at the bedside. So that is a very um, important thing by administering medication. Number 10 is that if a client vomits after taking an oral medication, we're gonna report this to the nurse that are in charge or the primary care or provider or anything. So next is number 11, taking a special precautions when administering a certain medications. So for the number 12 is that most hospital policies will gonna require new orders from the primary care provider for a client's post-surgery care. So number 13 is that when a medication is omitted for any reason and then record the fact together with the reason. Number 14 is that when a medication error is made, report it immediately to the nurse that are in charge. So for the 15, which is the last in administering medications, always check a medication's expiration date. So that's it for the 15 administering medication.